All right. So it should yeah. Can you stop share so I can share? All right. All right. Good morning, everyone, and welcome to Ateneo de Manila University Department of Economics and Ateneo Center for Economic Research and Development Seminar Series. So this is our first seminar this semester, and welcome back to our students. Welcome back to the campus. So we're now back in campus, face-to-face, doing our classes, but our seminar is still online because we've invited researchers in the US and in Asia and elsewhere. Okay, so for those of you who are new to the seminar, let me just remind everyone of our house rules. First, we will let the speaker finish her presentation before we entertain questions. For the participants in Zoom or in YouTube, we're live in YouTube. Kindly stay muted and stop sharing your video during the duration of the presentation. When we go to the Q&A, please virtually raise your hand and wait to be acknowledged. You may unmute and show yourself when asking your questions, and also introduce yourself to the audience as well as to the speaker. Participants on YouTube, please post your question in the comment sections and we will ask them for you. Slides, videos, and other materials from the seminar are posted on our website and in our YouTube channel only when the speaker give their consent for sharing them. So this morning, our speaker is an associate professor of economics at the University of Hawaii at Manoa, a research affiliate at the Isa Institute of Labor Economics, and a research fellow at the University of Hawaii Economic Research Organization. She works primarily on topics in development, health, and labor economics, and currently serves as an associate editor for the Journal of Health Economics. She received her PhD in economics from University of Southern California and her undergraduate degree from Stanford University. And she's also a Filipino. She's here with us to present her research on mental health and COVID-19 cash transfers in the Philippines, the importance of existing social protection program. Everyone, please join me in welcoming Dr. Teresa Molina. Teresa, the floor is yours.
Thank you. Let me share my screen. Can you see my screen okay?
Yes, yes.
Okay, great. All right, thank you so much for the introduction, Mahan. Thank you everyone for being here. Let me quickly say that this project is very much a work in progress, and so we're really looking forward to hearing your feedback today. You may have noticed that the title changed very slightly and the framing has changed very slightly from when the seminar announcement was first sent out, but the bulk of the results are obviously still the same. But like I said, looking forward to your feedback. This is joint work with Yoon Young Cho from the World Bank. She was actually in the Manila office for some time, but now she's back in DC. So let me just jump right in. Sorry, 1 second. Moving the video screens elsewhere. So when we think about the relationship between social protection and mental health, one key literature comes to mind, and that's the literature that looks at the relationship or how essentially cash transfers causally affect mental health. And I'd say that sort of the seminal paper in economics on this was the QJE, the Quarterly Journal of Economics paper by Haushofer and Shapiro, published in 2016. But by this point, there are, many other studies on this topic. In fact, there are enough studies for a review paper, which is what this McGuire et al. Paper is. It's a review paper on over 40 studies that look at how cash transfers affect mental health. And broadly speaking, these papers generally find that cash transfers do improve mental health. Now, I should say that this evidence primarily comes from researcher-driven RCTs conducted in normal times as opposed to, pandemic or crisis times, which is what I'm going to be focusing on today. And the other point to make is that evidence on existing government programs, as opposed to, these researcher-driven cash transfer randomized control trials, is a little bit more limited. Now, moving on to thinking about social protection and mental health in crisis times, I think it's clear that this is a very important issue. As we all know, the COVID-19 pandemic, along with all the economic turmoil and mobility restrictions that accompanied it, had detrimental effects on mental health. And while we might know this from personal or secondhand experience, it's also the case that empirical studies have started to document this using available data. Now, at the same time, most governments responded to the pandemic by either adapting or introducing new social protection policies. And the most popular of these social protection policies were actually cash transfers. So given this, we think it's important to ask whether existing social protection programs matter more for mental health in crisis times, right? And I want to, emphasize here that the answer isn't really obvious. It might be the case that social protection programs matter less during crisis times if it's the case that the magnitude of the shock that we're talking about is just too large, or if the new government policies that are implemented in response to the shock again, are so large that they end up taking precedence over the existing social protection programs. On the other hand, these programs or social protection in general might be more important if it's the case that the returns to social protection are increasing in vulnerability, or if it's the case that social protection enhances the effectiveness of these new emergency government policies that are put in place to respond to the crisis. So again, it's not clear ex ante what the answer to this question is. And for this reason, we think it's important to approach this empirically, which is what we're going to be doing in this paper. But before I get into those details, I will say that, what we're doing is we're expanding on some existing work, and in particular, two closely related strands of COVID-19 focused studies. So the first strand of literature looks at the effects of emergency cash transfers on mental health. And the second strand looks at the effects of existing social protection programs on mental health. So let me begin with the first strand of literature that I've mentioned. And I'll just start off by saying that the evidence is a little bit mixed, generally positive, but somewhat mixed. So in the United States, a cash transfer randomized controlled trial. So this was researcher driven. This wasn't, looking at the cash transfers implemented by the government. These cash transfers were initially only found to have improved mental health for low-income individuals. And in a follow-up study that then restricted, or kind of focused on low-income individuals, the same set of authors found no effects. In Colombia, these emergency cash transfer programs were estimated to have positive, coefficients on the treatment effects, but statistically insignificant, so kind of interpreted essentially as null effects. And finally, there is one study that finds positive effects. So these transfers were implemented in Mexico, targeting self-employed and informal workers. And these cash transfers were found to have had large and statistically significant improvements in psychological well-being, even several months after the transfers were distributed. Now, moving on to kind of the second strand of literature, the ones that look at existing social protection programs, these were generally found to have had positive effects on mental health. So there's a paper looking at a Bolivian pension program. There's a paper looking at a South African pension program. Both of these were found to have significantly reduced mental health problems, both stress and psychological distress. A third paper that I want to mention was an RCT conducted in Kenya. That the purpose of this study was to examine the effects of universal basic income. So this was not a government program, but it was something that had been put in place by researchers several years before the pandemic. And so, which is why I've kind of lumped it in these existing social protection programs umbrella. Now, this paper found that these UBIs had small but statistically significant impacts on depression. Now, of these papers, only the Banerjee paper was also able to estimate mental health effects in non-pandemic times and compare the two. And they reported them to be quite similar, actually. However, all of them, including the Banerjee paper, found that the effects on hunger were larger during the pandemic, which suggests that there might be some potential for larger mental health benefits during a crisis, right? So still, I think, definitely not an answered question, still something that we need sort of more empirical analysis on. So let me just take a second and kind of take a step back and tell you where we're going here after having motivated the paper, hopefully. So our question is, does social protection matter more for mental health during a pandemic? We're going to be looking at the Philippines during the first year of the pandemic, and our approach is relatively straightforward. We're going to be comparing the trends in depression in two different groups. One group is a group of beneficiaries of an existing conditional cash transfer program, and the other group is a group of similarly poor households that were not beneficiaries of this conditional cash transfer program, which the 4Ps program, which most of you are probably already familiar with. Now, our main result is that depression increased for both groups during the pandemic, but the increases were smaller for existing beneficiaries. So in other words, the pandemic generated a gap between the two groups, which we interpret as evidence that it seemed like social protections mattered more once the pandemic hit, right? Because there were no gaps between the two groups beforehand. These gaps emerged during the pandemic, which we're interpreting as increasing importance of social protection during pandemic times. Now, in terms of the reasons why, we actually find evidence for sort of both of those propositions that I made at the beginning. It seems to be the case that the existing social protection program enhanced the effectiveness of the emergency cash transfers. How to do this is it essentially improved the timeliness of transfers for existing beneficiaries. And I'll go into more detail about that later. But the other thing that also seems to be the case is that the social protection element, in this case, these conditional cash transfer programs, also appeared to be more beneficial during these periods of vulnerability. Okay, so that's kind of the overview of the study. Let me now jump into some background about the setting. And this is obviously an audience where I don't need to spend much time on the background. You probably know much more about this than I do, but I do want to highlight, just kind of go through these slides to highlight the things that I'd like you to keep in mind as we go through the analysis. So the government response to the pandemic in the Philippines consisted of both strict quarantine measures as well as a generous emergency cash transfer program. So this cash transfer program was called the Social Amelioration Program, or the SAP. It involved one, and in some cases, two cash transfers distributed to poor and vulnerable households. The government was targeting 18 million households, or 70% of the population, and this target included about 4 million households who were already part of the government safety program, the 4Ps program. Now, the amounts ranged from 5,000 to 8,000 pesos, depending on the region, which is approximately the monthly wage of a minimum wage worker, so they were quite large. And just to give you a sense of how, I guess, broad the coverage of the SAP was, it actually ranks in the top 10 of cash transfer programs in terms of size measured by the number of beneficiaries. So this is, it ranks 1, 2, 3, 4, 5, 6 out of all cash transfer programs implemented during the pandemic. In terms of the share of the population, it's not in the top 10, just because the Philippines is a very large country, but I should mention that it does rank quite highly. So in the end, the SAP reached about slightly less than 70% of the population. So it's still quite high up here, just a little bit lower than the top 10 in terms of share of population. So now what's the social protection program that I'm going to be talking about? As I mentioned, it's the Pantawid 4Ps program. It's the national flagship social protection program in the Philippines, where eligibility is based on a poverty score cutoff and the presence of children in the household. So essentially, you need to be below a certain poverty cutoff, and you have to have kids or a pregnant woman in the household. It's a conditional cash transfer program, which means that cash is distributed if the household abides by certain or kind of satisfies certain conditions. The education program, the condition is essentially that your kids go to school. So households get between 300 to 700 pesos per month per child attending school. The health component is a flat transfer of 750 pesos per month, conditional on the household satisfying certain health-related requirements, like getting all the children vaccinated and participating in family development sessions. Now, importantly, almost all 4Ps beneficiaries, 95% in our sample, received transfers electronically through a cash card. They also benefit from other social programs, national health insurance, rice subsidies, and some newer unconditional cash transfer programs that also target poor and vulnerable households. So a family of 5 that complies with all conditions will receive about 1250 pesos per month. So this is just kind of a family of 5 of all the different potential age categories, just to illustrate a possible transfer. Plus, if they're also part of the train and the rice subsidy program, then they'll also get an additional 900 pesos. And so what did the pandemic and in particular, the emergency cash transfers look like for the 4Ps and for those who are not already in the 4Ps program? So for the 4Ps, the SAP top-up was delivered electronically at the beginning of April 2020. And I'm calling it a top-up because it was essentially the 4Ps got their regular transfer, and the difference between the larger SAP transfer and the regular CCT is what they got as a top-up. So that was for the 4Ps, but for the non-4Ps, there were many delays. So the non-4Ps had to manually register using paper application forms. They received the funds physically. So 85% of them in our sample received them at the local government unit, 13% from a land bank branch. The median date of delivery for non-4Ps in our sample was April 29, so almost a month after the 4Ps got them. According to admin records, about 3.6 out of 14 million non-4Ps received the SAP by April 25. So essentially what this is telling us is that the majority of these non-4Ps who received the SAP were receiving it around the end of April. I'll also mention, although this doesn't turn out to be a key part of our results, I'll also mention that there was the second SAP transfer targeted to a smaller subset of beneficiaries. Now, most eligible 4Ps received this second transfer by the end of June, at which point almost none of the non-4Ps who were eligible had. They started receiving it mostly by the end of July. Okay. So our data set was collected in 4 survey waves. There was a baseline survey conducted before the pandemic for a project completely separate from the pandemic. And then 3 surveys were conducted via phone. Sorry, the first baseline was conducted face-to-face. The 3 surveys during the pandemic were conducted over the phone. And so the sample for these surveys consisted of both 4Ps and non-4Ps households who had been used in previous impact evaluations of the 4Ps program. So they were people or households who had poverty scores just below and just above the eligibility cutoff. So if you want to, try to think about who is this representing in the country, they have, if you look at the full sample, their characteristics are quite simple, similar to the sample of poor and near poor households from a national survey. So that's about the bottom 40% of the wealth distribution. So I've given you a little bit of detail. So now let me sort of tie everything together and kind of add specific dates just to give you a better sense of what's going on here. In December 2019, Wave 0 was conducted face-to-face for a completely different project. In March, on March 11, the WHO declared a pandemic. On March 16, 2020, ECQ, the first of the very strict quarantine measures, was implemented in Luzon and then later spread to other regions. Pretty soon after this, March 24, the SAP was announced. And like I said, by the beginning of April, the first SAP top-up was distributed to the 4Ps beneficiaries who had a cash card. At the end of April, Wave 1 was conducted over the phone. And by this time, sort of about 1/4 of the non-4Ps recipients had received the SAP transfer. So they're slowly starting to get it. At the end of May, I'll just pointing this out here, the 4Ps beneficiaries were scheduled to receive their regular bi-monthly payment, that conditional cash transfer that they're eligible for. All the conditions were waived, by the way. So they didn't need to, schools were closed, so they didn't, the kids didn't need to go to school, but they were still getting their transfers. At the end of June, Wave 2 was conducted over the phone. By this point, most of the non-4Ps in the sample had received 1 SAP payment. And the 4Ps beneficiaries who were eligible for the second SAP started to receive these payments also. Wave 3 was conducted at the end of July. 70, so again, here, most of the non-4Ps who were going to get their SAP had received it already, and they were also slowly starting to receive their second payment. And at the end of July is also when the 4Ps beneficiaries were scheduled to receive their bi-monthly payment. The last wave, wave 4, was conducted over the phone at the end of October. So apologies if this is a little bit small, but I'm starting off here with a table comparing the characteristics of the 4Ps and the non-4Ps beneficiaries. And so the first thing I want to highlight is that if you look at the characteristics, they're actually not so different. So in terms of education levels, in terms of business ownership, adult employment shares, weekly earnings, farm ownership, all of these statistics look very similar across the two groups. If you look at, number of mobile phones, number of smartphones, these are things we only were able to collect in wave 1 as opposed to wave 0, but those look similar as well. There are, however, a couple of differences. So the household size is significantly larger among the 4Ps compared to the non-4Ps. And because of, policy essentially, because 4Ps are eligible for free PhilHealth, they are more likely to report having insurance. And they're also more likely to report having a bank account, which we think is a result of them having that cash card, which isn't technically a bank, but that, it's probably what's driving these differences, the reporting of having a bank if they have that cash card. So in short, the 4Ps look fairly similar to the non-4Ps, but there are some differences. Why do they look so similar, right? Remember, the 4Ps, they're supposed to be under a poverty cutoff, and so we might expect them to look either less educated or to be earning less or working less. But as it turns out, these cutoffs were determined, and eligibility for the 4Ps was determined quite some time ago. I think most of the people in our sample joined the 4Ps in 2015 or before. And so there hasn't been a lot of updating, during which time conditions have been changing for both of these groups of households, perhaps resulting in sort of more of a mixing of their various kind of summary statistics. So that's what we think is going on there. Geographic distribution of the sample. This is where the sample is coming from. There's not a single province that's kind of dominating the sample, which is good. And also I should mention that 4Ps and non-4Ps, if you do this figure for the two groups, it looks almost exactly the same. So it's not the case that we're drawing different groups of, we're drawing 4Ps and non-4Ps from different parts of the country. So I wanted to put this table up just because this is sort of an interesting data collection exercise where, first of all, the baseline was conducted for a different reason. Phone surveys were kind of designed quickly and responded quickly to lots of different changes. So we don't have consistently collected information on everything. So obviously we have our household demographics in the first wave, and that's kind of all we needed. We only need it from the first wave, or the baseline wave, I should say. Mental health, we have two different measures of mental health. We have the PHQ-9 and the MHI-5. So let me just show you briefly kind of what these questions look like. These are the questions for the PHQ-9, basically asking about how individuals have been feeling over the past 2 weeks. They respond, using kind of this Likert scale, which can then be converted to a depression score. And then those scores can then be categorized kind of based on the psychologists that develop these things. They can then be categorized into severe, moderate, mild, and minimal depression. So that's kind of that's what we have from the baseline. For the wave 3, we have a slightly different set of questions, but, capturing very similar things. We have still have the same situation where we have this Likert scale and we have a depression score and then have numbers that can be categorized into different levels of depression. So we're going to be using these categories, not the actual score. Unfortunately, in wave 3, so in wave 0, the baseline, we have mental health measures for all adults in the household. In wave 3, we are only able to get it for the one main phone respondent. Income and employment we have throughout. Food insecurity we have only starting in wave 1, and we have just a simple question for wave 1 and a more detailed set of questions for the following wave. So let me just show you the basic question. In the past 7 days, did you or any other family member eat fewer meals in a day because of lack of food? And it's a simple yes/no response. The set of questions becomes much more extensive in the next 4 waves, but in order to be able to compare across the waves, we restrict to sort of that one question that is the most similar to the wave 1 question. So now jumping to our empirical strategy, essentially what we're doing is we're using our depression. This is an indicator for being, having severe depression, moderate, any depression as our outcome variable. We have a 4Ps dummy, a wave 3 dummy, and then the interaction between the two. Oh, sorry, 1 sec, the lights. Sorry about that. I guess the lights were on timer. Anyway, so here X represents some combination of controls for gender and age, household fixed effects, and individual fixed effects. So when we have individual fixed effects, note that we're going to have to drop those who responded in wave 0, but not in wave 3, right? So this individual fixed effects is going to mechanically restrict us to panel respondents. We cluster our standard errors at the municipality level. And what is our coefficient of interest? Our coefficient of interest here is beta 3, because this captures how the 4Ps effect changes during the pandemic, right? So if beta 3 is negative, that means, during the pandemic, the 4Ps effect was smaller, or depending on the size of beta 1, obviously. And if it's positive, it means that, the increases in depression were larger for the 4Ps. So here's our main table, starting with column 1, where we have no additional controls, no fixed effects. How do we interpret these coefficients? The 4Ps main effect here gives us the difference between the 4Ps and the non-4Ps in wave 0. And as you can see here, there's actually no difference between the two groups. Small coefficient, statistically insignificant. Now in wave 3, so this wave 3 main effect coefficient here is large. It's a large and statistically positive and statistically significant 0.33, which tells us that for non-4Ps, depression increased by 33 percentage points over a mean of 1%. So that's a huge increase. Now, I do want to be clear that obviously our scales are changing, our measurements are changing a little bit from wave 0 to wave 3. There might be some differences in responses to those, but the fact that the increase is so large, I think, just tells us this can't just be a measurement issue, right? It does seem to be the case that depression skyrocketed over this time period. But more importantly, kind of our coefficient of interest, this beta 3, tells us that the 4Ps increase was significantly smaller than the non-4Ps increase. So it's about a third smaller than the non-4Ps increase. Now, all of these results remain quite consistent across specifications, where we control for household fixed effects, age and gender controls, and then finally here, individual fixed effects, where we're restricting only to those panel individuals. So you can see the sample size drops quite a bit, but we still have very similar effects. I'll just quickly show you here that for moderate and any depression, patterns are similar, but no statistically significant coefficients, although the patterns are quite similar. So we do run a couple of robustness tests. We show that the significant beta 3 is not due to differences in observable characteristics between the 4Ps and the non-4Ps. Now, I want to highlight this because it's quite important, right? The 4Ps and non-4Ps, they're not identical. The 4Ps were more likely to have had insurance. They were slightly larger households, and these things might have generated differential trends during the course of the pandemic for these two groups. So to make sure that's not the case, we essentially rerun our whole specification, but we instead control for all of these unbalanced characteristics interacted with a wave 3 indicator. So what that does is that it allows these other characteristics to generate differential trends. Now, even controlling for those potential differential trends, we still see the same results, which tells us that it's not about these baseline characteristics or these unbalanced baseline characteristics. We also show that the significant beta 3 is not simply because the non-4Ps in our sample had a lower likelihood of SAP receipt. So when we restrict to those who received the SAP, we still see essentially the same results. Now, what have we documented so far? We've documented a large depression gap between 4Ps and non-4Ps, which emerged during the pandemic. So that leads us to ask, kind of, what about the trajectories of these other potentially important variables like employment, earnings, remittances, and food insecurity? So when we look at these things, interestingly, we actually don't find too many. Employment shares show a very similar pattern for the 4Ps and the non-4Ps. Weekly earnings show a similar pattern. Remittance receipt, we only have those for wave 0 and 3, but they show a similar pattern as well. And the one place where we see even some difference at all is in food insecurity. So in food insecurity, we see that food insecurity is higher for the non-4Ps in wave 1, and then kind of becomes more similar to the 4Ps after wave 1. What's so special about wave 1? Well, this is the time period in which the 4Ps had received their SAP, but most of the non-4Ps had not. And so that appears to be important here for driving food insecurity. And as you can see from the regressions, that's the only difference that is statistically significant, wave 1 food insecurity. So now, taking a step back and thinking about potential explanations, we're seeking to understand why the 4Ps was more beneficial during the pandemic. And going back to the sort of introduction where I proposed these two potential mechanisms, let me kind of restate those. So the first possibility is that the 4Ps program enhanced the effectiveness of other government programs. So in this case, the SAP. The other possibility, the second bullet point here, is that social protection, in this case, the CCTs, was just more powerful in times of vulnerability. So we actually do already have some evidence for this first bullet point, right? We know that the 4Ps beneficiaries had received their transfers in a more timely manner. And we also know and saw that this led to lower food insecurity in wave 1. So what we're going to do next is to explore heterogeneity by the timing of SAP receipt by the non-4Ps. Now, to investigate the second bullet point, whether these CCTs are just becoming more important during the pandemic, to do this, we're going to explore heterogeneity by timing of CCT receipt by the 4Ps. So two heterogeneity analyses. So this is the results of the first one. Here, what we're doing is we're looking at the wave 3 effect separately for the non-4Ps who received the SAP at different time periods. Now, I want to highlight here that timing here is not exogenous, right? And that's something that I really want to emphasize. We should not think about these as causal effects. We have to consider the fact that there might be some differences across these groups that could be driving some of these patterns. So in particular, the non-4Ps who went and received the SAP, who went and applied, stood in those lines, filled out their forms, the ones who received them very early may have well been the ones who were the worst hit and needed that SAP the most, right? So it's a little bit tricky to interpret these results, but what we do find is some evidence that timing matters. So this wave 3 effect, wave 3 main effect, shows us the 4Ps, the increase in depression for the 4Ps group. This interaction term tells us that for the non-4Ps who received the SAP before April 21, they saw an even larger increase. As I said, that could be because these were the people that were hurting the most and sort of needed these transfers the most. But if we, move on from this first earliest group, we find that kind of consistent with the idea that timing matters, we find that these coefficients get larger and larger as you get later and later. So the group that suffered the most in terms of depression increases were the groups that received the SAP quite late. So again, although things are a little bit murky here because of the endogeneity of SAP receipt, there does appear to be some evidence that timing matters a lot. Now, the next thing we do, remember this is, so I looked at heterogeneity by non-4Ps, timing. Here I'm now going to look at heterogeneity by 4Ps, timing. So in this regression, with this wave 3 coefficient here, tells us that depression gives us the depression increase for the non-4Ps group. We then look at the difference in trends for two different 4Ps groups. 4Ps who received the last CCT before July 2020. So those for whom it had been quite some time since their last conditional cash transfer. And then we also look separately at groups who received their last cash transfer quite recently, so in July 2020. Now remember, this measure comes from wave 3, which is just after this time period. And what we see is that the 4Ps group, where we see the biggest benefits, are the ones who received their CCTs recently. So in other words, there seems to be a gap between, this gap that's emerging between the 4Ps and the non-4Ps seems to be driven by people who have recently received a conditional cash transfer. And this suggests to us that these cash transfers, the continued use of these cash transfers, are important, and in fact are becoming more important during the pandemic. Because note, we don't see any differences between those two groups prior to the pandemic. That's what these coefficients are showing us here. Sorry, I know I'm probably running a little bit out of time, so let me quickly go through my discussion and then I'll just leave the conclusions on the slide and take questions. So again, going back to this discussion about why the 4Ps program was more beneficial, we have here, these two broad possibilities: enhanced effectiveness of other government programs and social protection being more powerful in times of vulnerability. We've already shown that 4Ps beneficiaries received the transfers in a more timely fashion and had lower food insecurity in wave 1. So this is a way in which, the SAP effectiveness was enhanced due to this existing network of social protection. In addition, just as a side note, I'll mention that this is consistent with a lot of evidence showing a correlation between food insecurity and mental health problems. Now, the other piece of evidence that I've just shown you is that we see the largest depression increases among those who received the SAP the latest. So that, again, provides additional evidence that it's this timeliness that matters in this context. And then finally, for social protection, the fact that we find the largest depression gap between the 4Ps and between the non-4Ps and 4Ps that recently received their CCT, that suggests to us that these continuous CCTs also seem to matter and seem to matter more during the pandemic. So with that, I will leave this conclusion slide up here. Thank you so much for your time. I'm happy to take questions or suggestions at this point. Thank you.
Right. Thank you. Hold on, let me. Thank you, Teresa. That's really very interesting and a lot of lessons and policy implications that I see in that research. Early on, participants are already asking if they can get a copy of the paper. I understand this is still a work in progress. Is that right?
It is. But hopefully in about a month's time, I think we'll be sharing a paper.
Okay, thanks. I hope there's a member of the DSWD here. There will be a lot of lessons learned from the research. But let's take questions from the audience. Anybody who would like to start? I see Nandi Aldaba here, who's also working on social protection. Okay, Nandi. Nandi, would you want to ask your question?
Actually, it's there already in the chat box.
Okay.
Oh, I see it. Okay, I can, so, the question was, what's the effect of an outdated list of 4Ps? Yes. Would this blur the difference between 4Ps and non-4Ps? Yes, so I think, I'm glad you brought this up. So I think I mentioned this briefly, but I would like to emphasize this now. I think the outdated list of 4Ps beneficiaries actually helps us a little bit in this context. I mean, it's not a good thing that the list is outdated. The list should be updated. But in our context, it helps us a little bit because it means that the 4Ps and non-4Ps that we're seeing are actually quite similar in terms of household characteristics, but the only thing different about them is that one is getting the CCT and one is not. If it were the case that they were much more different, I think it would be harder for us to argue that what we're seeing is the result of the program as opposed to their characteristics. So I think it actually helps us in terms of the empirical strategy here, but it's not a good thing in the sense that those lists should be updated.
Yeah,
All right.
Teresa.
Nandi. Okay. Okay. Thanks, Nandi. Thanks, Teresa. Okay, I think you're kind of frozen again, Teresa. Okay. Okay, next question. Wait, let me see. I'm not seeing the grid. Okay. Anybody? Question? Yes, Jeff. Jeff?
Hi, Teresa. Good morning. Can you hear me?
Yeah.
I just wanted to ask whether it's possible to do the analysis comparing 4Ps beneficiaries with cash cards and without cash cards, because I think that is potentially an important policy implication. If it was just a cash card that matters, then I
see.
Additionally, this is also related. Will you be able to control also for those who receive support from, for example, families and friends? And they're sort of related because, well, there's a time varying variable that could be correlated with receipt of
Sorry, what was
support
the
during the whether they receive support from other sources like families and friends during the pandemic. Because if they have cash cards, which presumably those 4Ps beneficiaries are more likely to have, then they're also more likely to have bank accounts which could receive support, for example, from abroad or from friends who live in other regions. Then that can also alleviate their I guess, depression during that time.
Yeah.
So is it possible to sort of tease this out so that you can exclude that as the source of the difference? Thank you.
Great questions. To answer your first question, I think in theory we could, right? We know who has the cash card, so we could in theory look at the differences. The only problem is that there's only 5% of our sample does not have a cash card, or 5% of the 4P sample does not have a cash card. So I do worry that we might be a little bit underpowered statistically, but I haven't looked at it, so I can definitely do that pretty easily just to check. Now, in terms of the families and friends, the only thing we are able to do right now to explore this is that remittances variable that I showed you. But unfortunately, this is just a dummy variable equal to 1. If you say that you do receive transfers from outside the household, and we don't see that seems to change for the 4Ps and non-4Ps. But of course, this is just an indicator variable. There might be differences in the intensive margin, and I don't think we can capture that. Although I'd have to dig a little bit more into the survey. There's always more questions that I realize I'd missed, so I can double check.
Okay, thank you.
Thanks.
Thanks, Jeff. Other question? I think we also have students in the room. Question from the students? Anybody? Yeah, so Teresa, because you're already looking at the data, I understand that this time, because we have a new secretary of the DSWD and is really much very much appreciative of the data and is trying to again make the 4Ps based on the database to avoid a lot of leakage. So because you're already, this may be a little outside of the paper, because you're already looking at the data, what do you think would be, the way to go in terms of, collecting data, and also, are there any questions that you think would be, useful for moving forward with the implementation of the conditional cash transfer?
Yeah, that's a great question. I think I'm not gonna answer your questions directly, but I am very interested in sort of this new updating essentially. And I think what this paper shows us is that these electronic transfers matter a lot, and admin data, I think, matters quite a lot as well. And so the more that we can have this sort of data available to be able to track 4Ps and ideally also non-4Ps over time, I think that's going to be very important. I think this is a really interesting time to do it because as you update the list, people drop out, people join. And so that I think is a good time to sort of figure out what are the effects of this program, what are the effects of graduating out of this program. And there's I think there are a lot of questions that we could answer with basically consistently collected data on these individuals. And I hope that they continue, or I guess they start collecting kind of more regular admin data on this kind of thing. I think it's an interesting time for sure.
Yeah. Well, are you looking also at the experiences in other countries? I mean, what would be like lessons learned to reduce leakage for CCTs like what we have in the Philippines? Would you be familiar in those kinds?
I'm the only other, the other CCT that I'm quite familiar with is Mexico's Progresa program, which was very successful for on a number of different dimensions and was kind of spread broadly across the country, but unfortunately now has been kind of, as of 2019, has been ended, which is unfortunate. I don't know too much about kind of what, in terms of the leakage, I don't know too much about kind of what made that successful at avoiding leakage. But I do think, again, these electronic transfers, these just digital payments are a big key. Digital payments and transparency are a big key to that, I think.
All right. Thanks. I think Nandi has another question. Nandi, are you there?
It's about social pension because as I mentioned, social pension studies in the review of literature. And as far as I know, in SAP, they also use the list of social pension beneficiaries. So I guess there's data on that. So we can do a similar study between social pension beneficiaries and non-social pension beneficiaries.
I wasn't aware of that. I'm not sure what we have in the data, but I will definitely, that would be super interesting. So I'll definitely look into that.
Yeah, maybe you can ask Yun Young.
Yeah.
If they have data on.
That would be cool. I agree. Yeah. Huh.
All right. Any other question? One last call. So we can let Teresa sleep. Teresa is right now in Washington, D.C. Anybody? Okay, so before we let go of Teresa, let me just invite you to the next seminar, and at the end, we're going to have our usual photo opportunity with our speaker. Let me just share my screen for our next seminar. Do you see it? Our next seminar will be on September 13, and this will be on migration, search, and networks. And our speaker is Professor Nancy Chow from Cornell University. So I would invite you to turn on your computer, but let me also let you know where you can find information about our seminar. So it's available in our website. It's here on the Department of Economic websites, and you just click seminar and you'll find the latest and upcoming seminars in the department. And if you would like to have or to watch again the YouTube recording of previous seminar, only to those speakers who give their consent for the recording of their video to be posted. It's here in our YouTube channel of the Ateneo University. And you can find all the previous seminar in our YouTube playlist channel, Economic Seminar Series. Okay, and for students and other participants who would like to request certificate of attendance, the request form will be open for a limited time only. Aya will be sending the link in the chat box so that you can request. And certificates will only be given to those who attended via Zoom and who accomplished the request form. For those who successfully completed the request form, kindly wait for a scheduled release of the certificate. So now, may I invite everyone to turn on your camera so we can have the photo opportunity. Everybody? Aya and Rainier, would you be taking the photo?
Yes, I'll just give everyone a few moments to turn on their cameras. Okay, so I'll be taking the photo in 1, 2, 3. One more. 1, 2, 3. Okay, thank you very much.
All right, so I would also like to thank Aya and Rainier for assisting us in the organization of the seminar. So once again, please join me in thanking Dr. Teresa Molina for the seminar today. Thank you. Thank you, everyone, for coming and attending the seminar. Bye, everyone. Have a good morning.